Deputy Catherine Connolly. 5 minutes.
Go the sucht an jesh an kesha ha cur tá se har vet táhachtach de galia ospidil nua agus I dús bar ba watam cogardicus a rád an ara nua agus gwim gahra ort either all nua. Minister, the new hospital for Galway is something that the people of Galway and indeed the region have been looking for some time, and indeed since my election to the Regional Health Forum in 2006 I and the other 39 councillors cross-party on that Regional Health Forum have recognised the inadequacy of the hospital site in Galway and the acute crisis that exists because of the congested site. And indeed, the Regional Hospital Galway, we note as that, it provides a leadership role in acute services delivery, providing regional services for a wide range of specialities, and is also designated supra-regional centre for cancer and cardiac services, serving a catchment area in the region of 1 million people from Donegal down to Tipperary North. That's the catchment area that this hospital is serving. And yet, waiting lists in the hospital for every single medical speciality on both inpatient and outpatient waiting lists have repeatedly made local and national headlines, primarily because of lack of capacity on the site, in addition to lack of resources. ENT procedures and operations, orthopaedic operations, urology, anaesthesia, pain management, rheumatology, dermatology, the list goes on, with absolutely damning waiting lists. In addition, we have the repeated cancellation of elective surgeries and procedures due to the input of patients through the accident and emergency that is causing great distress and great pain to the patients. And in addition, we have a trolley crisis, and despite the best effort of staff and nurses and management, we have a trolley crisis, and we have the research telling us that over a particular age, if you spend more than 2 days on a trolley, you're going to have a longer period of time in hospital, causing greater cost to the exchequer, not to mention the psychological and physical hurt to the patient. And further, notwithstanding, and this is important, Minister, and I accept that projects are planned and projects are underway, but notwithstanding the planned projects and the process of construction of a 75-bedded ward, a 50-bedded replacement ward, a 50-bedded mental health unit and an ED unit which is planned. Both the clinical director of the hospital and the management of the Sailta Group, and this is what's important, Minister, have very recently acknowledged that all of these developments on that congested site are simply firefighting exercises, and that there is an urgent requirement to have a new hospital and to begin the planning for that new hospital as quickly as possible. Furthermore, it has been highlighted that notwithstanding all of these developments, when they're up, we will have only extra capacity of 25 beds on that congested site. And moreover, it's absolutely recognised by everybody in Galway and the region that the UHG site is congested, cannot cope with the existing demands, and that the parking is inadequate, with cars parking for hours to get in. On top of all of that, Minister, and I've pointed out in my question, on the risk register, the capacity or the lack of capacity in the hospital is the most worrying aspect when they've done their risk assessment to produce the risk register. In view of that, in view of the open acknowledgement, which I really welcome, and the frank nature of the manager, the management and the clinical director, that they can't go on like this. They're doing their best, but that they need a new hospital. In view of that candour, in view of that honesty, could you please address whether you have met with management, whether you have met with the clinical director, if you haven't, when that's going to happen, and what steps are being taken to put in place the plans for a new hospital? And I'll finish by saying there are 150 acres of land on the Merlin Park site. I fully support the residents there who don't want to see the woods demolished, and we should be preserving them. But on the footprint alone, without touching a tree, a new hospital could be built. There's also another site in Galway, the airport site, if the Merlin didn't prove to be the suitable one. I don't mind where. What we want in Galway is a new hospital. Thank you, Minister.
Cahir, and I want to take this opportunity to thank Deputy Connolly for raising this matter and indeed for her good wishes, and I'm very pleased to have the opportunity to update the House in relation to hospital developments in Galway. Galway University Hospitals, comprising of University Hospital Galway and Merlin Park University Hospital, provide a comprehensive range of services to emergency and elective patients on an inpatient, outpatient and daycare basis across the two sites. UHG has approximately 700 beds and is a tertiary referral centre for the Western region. Its emergency department has approximately 62,000 patients attending annually. The Programme for a Partnership Government has committed to progressing a new emergency department facility for University Hospital Galway. Development of this new emergency department is a capital priority for the Céilteachta University Healthcare Group. The HSE Capital Plan 2016 includes funding for a full option appraisal and cost-benefit analysis to inform planning and funding requirements for a new emergency department at Galway University Hospital. The cost-benefit analysis in relation to a new emergency department is in its final stages, and it is anticipated that this will be completed shortly. If this is favourable, this will then progress to design stage this year. While there are no plans for a new hospital to be built in County Galway, considerable developments, some as outlined by the Deputy, have been ongoing to improve facilities at Galway University Hospital. Pending the development of a new emergency department in Galway University Hospital, in order to alleviate pressures and to ensure that patient experience in the existing emergency department is improved, 30 additional beds opened at the hospital earlier this year. In addition, a number of significant projects have been completed at Galway University Hospital in recent years. These include the clinical research facility, the upgrade to the maternity unit and the cystic fibrosis outpatient department, which was completed in 2014 and is now operational. Furthermore, there are also two major developments currently underway in Galway. Construction work is ongoing on the new 75-bed ward block, which will provide single-room inpatient accommodation. Also, a new acute mental health department is underway and is expected to be completed early in 2017. Following the transfer of mental health services to the new acute department, work will begin on the construction of a national plan for radiation oncology project, for which the HSE has already obtained planning permission. Further investment in individual hospitals must be considered within the overall acute hospital infrastructure programme and the establishment of the hospital groups. In relation to Deputy Connolly's question regarding whether I've yet met the hospital group, I haven't, but it is my intention to meet all of the hospital groups in the coming weeks. I'm currently engaging with all the frontline stakeholder organisations. I had a very productive meeting with the INMO today, with the IMO the previous week, and with more of the frontline union representatives tomorrow. But I do expect to meet the Céilteachta board and it was said about in relation to all of the healthcare issues.
This issue was my question.
Well, there will be an opportunity, obviously, Deputy, for the hospital, through the hospital group structure, to raise whichever issues it wishes to raise with me. This will be a meeting for me to ascertain the priorities of that hospital group in terms of the development of healthcare facilities in the region. You also made a valid point in relation to, obviously, the ongoing need to tackle the trolley crisis, which has shown some signs of improvement in this month, but overall this year is still marginally up, and I know Galway is a particular area of difficulty at certain times. I am attending my first meeting of the ED task force, which is co-chaired by the INMO and the HSE with relevant stakeholders on Monday, and I'll certainly seek an update in relation to the Galway situation at that meeting as well. So I'm happy to keep in touch with Deputy Connolly on these important matters, and I hope I've had an opportunity to outline some of the service improvements that we're planning, some of the capital projects that we're planning, and I look forward to having an opportunity to meet the Céilteachta Hospital Group within the month of June so we can further discuss their priorities for the region. Thank you.